Welcome back to Arise News Hour. I'm Faith Orr in Abuja. Turning to Kenya now, where doctors have been holding more demonstrations in their push for better pay and working conditions. Thousands of healthcare workers have been on strike for almost a month. They're fighting for the government to put in place an agreement on better wages that was made back in 2017. But President William Ruto says the country has no money and has asked them to return to work. I want to bring in Conditions-Okoro in Nairobi. He's the Executive Director of CFK Africa. That's an NGO which focuses on improving public health in Kenya. Jeffrey, thank you so much for joining us on Arise News. This isn't the first time that doctors and other healthcare workers have gone on strike in Kenya. We saw a number of patients die from a lack of care when it happened in 2017. And as always, it's the most vulnerable that suffer with these things. What impact are you seeing that this is having on patients this time?
Thank you for having me, Faith. Well, yes, we are having negative health outcomes so far from the strike. We have noted, regrettably, a number of patients who are not able to access basic care, mostly coming from informal settlements, choosing to opt for going to pharmacy or other traditional medication. Some also just giving birth at home, which is, frankly, really sad.
I saw a story that you had written, and you had made reference to one woman who had gotten a motorbike to one of the healthcare centres provided by your organisation. I mean, it seems that women in labour are being forced to take transport options like this. Just how bad is the situation across the country?
The situation is really difficult for a lot of families and a lot of folks who are not able to access private health facility. So that was just one example, but so far we've noted a number of Kenyans traveling far and wide to accessible health facilities such as CFK's Tabitha Clinic, just to get basic medical care. We've also noted instances where mothers who have complications and need actual surgery are not able to get those services. And Kibera is just a small portion of what's happening in the country. And just to put this into context, the over major health referral clinics in Kenya provide services to the majority of the country. And with them not being accessible, that health burden is left to small dispensaries and small health facilities. And what we are going to note over time, if we are not already recording, is high cases of complications, if not mortality, in the country. And sad enough, that is not really being looked into thoroughly. So that's really worrying for us.
And, it doesn't seem like some of the doctors' demands are that unreasonable. We've been hearing that new interns have apparently had their salaries reduced by around 91%. This is a job where people's lives can hang in the balance. Surely we want doctors to be looked after as well as patients.
Absolutely. Doctors play a critical role, in the entire health ecosystem of this country. And so the current discussions around the CBA, collective bargaining agreement, that they had in 2017, it's not been honored. And I guess from our side, we know the critical role they play. But what we are really pushing for is just looking into the fact that without doctors, this entire system is going to collapse. And so it's critical that the government and the doctors push these talks so that they can come into an agreement. For us as humanitarian workers, we do not want to respond to crisis. And so we are hoping that they can come into some kind of agreement.
You've heard from some hospitals already laying off these striking medics. Government officials say they can be replaced. I mean, is that true? Surely there isn't just a store of spare doctors waiting to be put to work.
Right. So I think some of those are not realistic, given that as a country we have a shortage of medical personnel. And yes, it's true that we've had cases of counties or other facilities mentioning that they're laying off doctors. And so we do not have, I would say surplus personnel to say that we are going to just replace them. They are the technical experts we have as a country and a resource. And so I think we should tread carefully as we are talking about, laying off doctors and, the entire medical infrastructure, highly depends on these doctors and, of course, the interns as well.
And President Ruto, I mean, he has said that he values doctors, but that the country has to live within its means. There has been, of course, exorbitant spending in other parts of government, and we know that the opposition politicians are backing the doctors. I mean, is that just political posturing, or could this do the government real damage? What do you see as the outcome to all of this?
Well, I might not know the outcome of this, but I could share what we are hoping for should be the outcome, which is the prolonged negotiation or the continued street demonstration by medical practitioners is putting lives at risk. And so it's in the best interest of the country, it's in the best interest of all of us that they get to a point where they can agree. I know that the government's its current stance is that they do not have funds to pay for the money being requested by the doctors. But at the same time, health is a fundamental human right, and for folks such as us who are working in informal settlements, we are seeing firsthand how this is turning into an absolute crisis that we will have to even use a lot more money to try to contain in the next month or so, because the cases are just going to get worse. The medical cases are worse.
Okoro, thank you so much for joining us, the Executive Director of CFK Africa. We appreciate your time.